Hi, my name is Christina Mitz. I'm a registered clinical nutritionist and I specialize in microbiome restoration. I have a background and training in use of FMT, administration of FMT, and client management when it comes to FMT and optimizing FMT outcomes. I was trained by one of the leading FMT labs in the world, and I'm 5 years in and still consulting for FMT labs and their clients on how to optimize outcomes using nutrition and other means. Today, I wanted to talk to you about using FMT or microbiome modulation to eradicate dysbiosis, specifically using the example of Klebsiella, because it's one that a lot of us who have experienced dysbiosis are familiar with and familiar with the stubbornness of it. Now, just to get into semantics for a second, those of us in the industry actually don't like the term FMT, but it seems to be something that has stuck. So that's why I'm using it in the title and the description, simply because that's what people are familiar with. But in actuality, we're not transplanting an organ. We are administering microbes and microbe solutions. So just for your knowledge, we do prefer the term microbiome therapy or microbiome restoration. Now let's get into it. So my first point today is that full-blown infection and subclinical infection are two very different things. So infection versus low-grade infection or dysbiosis, very different things. And I think a lot of people become attracted to FMT because they have read the research on how patients with infections, they've seen how those patients with infections respond to FMT, and it's typically a very positive response. So C. difficile obviously being the original infection that's treated with FMT, but now also today I'm talking about Klebsiella, and so we're seeing more and more research and clinical trials where patients are being treated, their Klebsiella infections, and these are full-blown infections, being treated with FMT with positive outcomes, and most patients are responding. When we look at the research, there are a number of meta-analyses, so reviewing the quality and the outcomes of these clinical trials where Klebsiella is being treated with FMT. The one thing I do notice is that even though most of them, they do use PCR testing to identify the Klebsiella pre-treatment, they aren't always following up with PCR, and that's a disappointing thing because we don't know now whether the Klebsiella is completely eradicated or whether they still have low levels of Klebsiella and now their immune system is keeping it in check. I think that would be something that would be really useful and important to be able to see in the future. I also wanted to show you and go through a case study of our own, and this case study really illustrates the idea that when it comes to dysbiosis or low-level imbalances of microbes, you can't always expect FMT to get the entire job done. There still needs to be some work put in as far as nutrition and lifestyle and diet and supplementation goes. So with this client, we had them start out by we did PCR testing PCR testing after a couple weeks in, and then a third round of PCR testing after a specific dietary change. If any of you are familiar with Klebsiella, you'll know there's quite a bit of research on using low-starch diets to reduce Klebsiella. So Klebsiella is a starch feeder. It will grow the more starch you eat. And Klebsiella has actually been found to cause, so not correlated, but to cause the autoimmune disease ankylosing spondylitis. So patients with ankylosing spondylitis will have antibodies to Klebsiella. Now, as far as what we did with our client, so this client wanted to reduce the suboptimal levels of Klebsiella in their gut, and we provided the nutritional advice, which they declined to begin with, which is how we ended up in this situation. And I was able to do this report and this case study because of that. But anyway, so we start out with administering the FMT. They administer the FMT daily. without any nutritional adjustments. So the macronutrients stay the same. It's really a balanced intake of carbohydrates, fats, and protein, and eliminating processed foods and processed sugar. Those were the few changes that were made to start with. However, a couple weeks in, the client was actually having an increase in digestive related symptoms, and so we decided to retest and see how things were shifting. So at the second test, we did find that the Klebsiella had actually increased, and then they had also been carrying a couple other proteobacteria as well. So at that point, we've emphasized that nutritional adjustments can be necessary in order to modulate the way that the new microbes are colonizing. And so this goes beyond Klebsiella. This applies to other microbes as well. So yeast, for example, obviously if you eat a ton of sugar while you're doing FMT, you're probably going to get some yeast overgrowth. If you are eating carnivore while you do FMT, you're probably going to get more protein digesting microbes. So that's how it goes. The things that they're exposed to, the diet, the supplements that you take, and your lifestyle, that's all going to influence the way that your FMT colonizes and how it sticks around in the long run. So after this client implemented the low starch diet that we recommended, and then a number of weeks later, we did follow up, and the Klebsiella was actually at 0, which is exactly where I'd want it to be. Ideally, you wouldn't be carrying any Klebsiella at all. So hope this illustrates for you the difference between using FMT or microbiome therapy for dysbiosis versus full-blown infection. I hope it emphasizes the importance of nutrition, lifestyle, diet, supplements, etc., and how that impacts the way that your FMT colonizes. So that is it for today. If you have any questions, drop them in the comments below.